first part of the series, we'll be looking at how the psychosocial impact that COVID has had on the mental being of children. With children, you'll notice that normally they've got highs and they've got lows. And with children, it's also very easy to pick up when a child is in distress, when a child is impatient, and when a child is annoyed. And all these characteristics actually happen in a space where a child does not have their usual routine or their usual mind stimulation that they get throughout the day. We must know now that the COVID has actually impacted on children quite a lot, because now children, there's a lack of outdoor activities, there's school closures, so they're learning online. They're no longer able to go to school and learn in class with their fellow students on a daily basis, and even play with their friends on a daily basis. So the things to look out for in children, mostly if you see that a child is feeling very stressed, you look at things such as their annoyance, at the levels of their annoyance, at the level of their impatience, and at the levels of their distress. So when it reaches to that point, then you know that the child has become uncomfortable with the situation. But what we can do as guardians and as parents, or even as teachers at school, we can try to stimulate their minds even more. Have age-appropriate conversations with the children, to make them understand what's happening, to make them understand what COVID is and why certain things are happening, why they cannot go out with their friends, why they cannot play with their friends outside, why they don't go to school on a daily basis. And this will also avoid children being misinformed about the COVID, to say maybe, for example, if a person coughs, just if they do a little cough, then they assume that the person has COVID, because this also creates anxiety and fear in children, that they would not want them even to go outside their own yard. So it's very important to have age-appropriate conversations with the children about the COVID, and then also to help them stimulate their minds by being creative. As much as they cannot go outside to play, they cannot have their friends over, but you can always spend time with the children doing the things that they love indoors. Children are very creative. They have a very vivid, wild imagination. Some of them they can play camping, or they can play school, or they can play doctor. A lot of things that children can do. So you don't discourage such action that children want to do. What you do actually just encourage them to be creative, and that they can stimulate their mind. And of course, the COVID also has can have a great impact on their routine, on their daily routine, and especially also their sleeping habits, because now children are used to that. If during the week they go to bed early, and then because they have an early morning to go to school, and then on the weekend they get excited because then they get to stay up late because it's a weekend. So the COVID has actually changed that in children, because now they're not going to school on a daily basis, so they get to sleep late almost every day. Their routine has also changed. So it's very important also to just continue to keep that routine, because in as much as they're not going to school, but they're still children, and they still need to have their sleep, and continue having their healthy diet, get them to exercise a little bit, so that they can also get stimulated, both mind, body, and just to keep them healthy. So in as much as we can feel that children, they're not affected by the COVID, but in an actual sense they're actually the most affected ones, because then you have that adults, maybe they're coming from a home where one parent could be a frontline worker, or one parent has got the COVID. So it's the children, they have to adjust to their environment. So it's very important that we keep the mental health of the children in check, just by following a few simple things. It's not something that one will have to go out and see a psychologist or whatever, but it's just keeping up the daily routine of the kids, stimulating their mind, and just embracing whatever questions they're having, but making sure that whatever you do, it remains to their age appropriate, and not also feeding the children misinformation about the COVID.